What I'd like to do is introduce you to a technique called flexion distraction therapy. As the name implies, we utilize flexion and distraction simultaneously. It can be applied to the cervical spine. We're going to demonstrate with the lumbar spine. Very effective for various conditions, especially disc conditions, but also stenotic conditions of the canal and so forth. What we do is utilize the fact that the table is hinged in the middle and apply flexion to the spine, and then mechanically distract or elongate the table. As you can see, the cushion's coming apart here. The same thing is theoretically happening to the segments of the spine. This treatment has been extensively researched and has been shown on cadaver studies to actually create a negative pressure in the neighborhood of negative 200 millimeters of mercury negative pressure inside that disc. So to reduce a disc bulge or a disc herniation, taking the pressure off the nerve. It also has the added benefit of helping stenotic conditions. This treatment has been shown to increase the size of the intervertebral foramen by 30% and the canal by almost the same amount. So it's effective for both of those types of conditions. Also, it has the added benefit of being effective for facet syndrome type of patients or biomechanical low back pain patients. Whereas your typical physical therapy extension exercises will actually jam those facets together. This treatment, as we apply the flexion to the involved motor unit, it opens those facet joints up, relieving the source of the pain, also returning motion to a segment that has become dysfunctional and improving the alignment. Also conditions like spondylolisthesis. For example, we can focus in on a level, for example, in L5 spondylolisthesis, we'll contact the segment above. So for an L5 spondylo, we'd contact L4 and distract caudally. So it's very focused. The physician can direct the treatment right at the exact level where the problem is. This aspect of the table allows us to apply the similar procedure to the cervical spine. This lets us treat bulging or protrusions of the cervical intervertebral disc, and decreasing the interdiscal pressure and reducing those. It also is very effective for stenotic conditions from degeneration, whether it's IVF stenosis or even canal stenosis with cord myelopathy. And then for patients who, for whatever reason, prefer not to have a manual manipulation of the cervical spine, this is very effective for your standard biomechanical neck pain or facet irritation. Also cervicogenic headaches originating from facet irritation in the upper cervical spine. It's very comfortable for patients, very well tolerated. Even patients with advanced degenerative changes that are very tender in the cervical spine really enjoy this treatment.